Welcome back to the Peanut Podcast, brought to you by the National Peanut Board. I'm Ashton Pellom.
And I'm Lauren Highfill Williams, and today's episode is a big one. We're celebrating a major milestone, the 10th anniversary of the Learning Early About Peanut Allergy study, also known as the LEAP study, a landmark moment in food allergy prevention that changed the game for peanuts and for families everywhere.
That's exactly right, Lauren. The LEAP study taught us something revolutionary, that introducing peanuts early and often in infancy may help prevent peanut allergies. And that flipped decades of old advice upside down on its head, that introducing peanut foods to babies between 4 to 6 months of age and continually, regularly may prevent peanut allergies. It's important to introduce peanuts in a baby-safe way, such as mixing breast milk, formula, or soft foods. Unless a baby is high risk, for example, has severe eczema or an egg allergy, no medical consultation is needed. If high risk, consult a healthcare provider before introducing peanut foods, and always monitor babies during initial introduction.
Good point, Ashton. So today we're looking back at how we got here and how we keep moving forward. You'll hear from the people who made it happen. Researchers, clinicians, dietitians, and public health champions who've carried this message into communities across the country. We'll also shine a light on what still needs to be done to make early introduction the standard for every family.
First, we're going back all the way to the beginning with the man whose research kicked off the entire movement, Dr. Gideon Lack, lead researcher of the LEAP study.
Dr. Lack's journey with peanut allergy prevention began with a question. Why was peanut allergy soaring in the UK and the US in the early 2000s, but almost unheard of in Israel?
I noticed that countries where babies were given peanuts early, there wasn't peanut allergy, particularly in Israel. And I want to do a study comparing the rate of peanut allergy in Israeli babies who are fed peanuts very early on, and in English babies where the advice was to avoid peanuts, and to see what the frequency of peanut allergy was in both populations, and to see what their consumption habits were. So it was difficult to find funding for that study. It was an observational ecological study until one day a peanut farmer and head of the National Peanut Board, Didi Darlene, walked into my office on a crazy day without, she was traveling, so she didn't have an appointment, came in and she said, "We want to fund your study." And I didn't know what she was talking about. And she had heard about the theory, and that led to a long and fruitful collaboration. So this first study looked at 5,000 babies in Israel and the UK, and the important thing is they were Jewish children, so they shared a similar ancestral or genetic background, which meant that any difference between the two populations would be due to environmental influences rather than genetic influences. And sure enough, we found the rate of peanut allergy in the UK Jewish babies was tenfold higher than in Israel.
That early comparison laid the foundation for everything that followed, but as Dr. Lack explained, funding wasn't easy until one unforgettable meeting.
Yes, Ashton, that peanut-loving surprise guest, who you'll hear from later in this episode, was Didi Darden from the National Peanut Board. And that moment launched a 2-decade collaboration that's still going strong.
She sort of made her way into my office, and if I remember correctly, she was wearing a T-shirt that said, "We dig peanuts," which I found quite amusing, and it's become a famous T-shirt. But no, immediately when she told me what this was about, I explained to her why I felt this was relevant based on animal work, animal models. She said to me, well, we want to fund your study.
So how did we go from avoid peanuts at all costs to feed peanuts early and often? According to Dr. Lack, the old thinking made intuitive sense, but it didn't match the science.
I was so convinced for decades that, well, the logic sort of ran, if a kid has peanut allergy, giving them peanut causes an allergic reaction, right? Well, that's obvious because they've got peanut allergy. Therefore, the way you're going to cause peanut allergy in young babies who don't have peanut allergy is by giving them peanuts. Now, that logic doesn't really follow. And the cause of the trigger event in an allergic child, i.e., eating peanuts, may be totally different from the cause of the disease itself.
It was a bold theory, and not everyone was ready to hear it. Ethics boards worried about choking hazards, breastfeeding guidelines, and even the use of peanut snacks like Bamba.
But the data and studies kept pointing to a new path, early introduction, and it all came together after one eye-opening talk in Tel Aviv in 2001.
So the big aha moment was when I gave a lecture in Tel Aviv around the year 2000 or just before to a group of Israeli pediatricians and allergists. There must have been a few hundred in the room. And I asked, they want me to talk about peanut allergy because people were starting to talk about it in the UK and the US. And they asked me, I asked them rather, sorry, how many of you seen a case of peanut allergy in your clinics in the last year? And less than a handful out of 200 put up their hand. Was in the UK, every pediatrician or allergist would have put up their hand. And we were starting to see an explosion in food allergies, especially peanut allergy. So something didn't make sense, and then I didn't. One possibility was they just didn't diagnose it, but that didn't make sense. They had highly trained pediatricians and allergists, so the other possibility was that it really didn't exist there. And at the same time, I found from speaking to them and to Israeli parents that they were feeding peanuts to the babies very, very early on in life. So that and I saw, in fact, went on went on a short trip with my family after, and I saw Israeli parents giving their little 4 or 5 month old babies peanut snacks.
That early research led to the LEAP study, funded by the National Institutes of Health. It was a massive undertaking. Over 600 babies tracked from infancy to 5 years.
This risk was diminished by more than 80%, and 2 to 3% of the babies in the consumption group had peanut allergy. So we'd protected more than 80%. In fact, in the babies who had negative skin tests to peanut at entrance into the study, the babies who hadn't started to show early development of peanut allergy, the protective effect was closer to 90%. And that's a huge effect size in any study.
And the protection wasn't just short term. The follow up studies, LEAP On in 2016 and LEAP Trio in 2024, showed those benefits lasted well into adolescence.
And then at 13 years of age, we did assessments for peanut allergy using preferentially and predominantly peanut challenges to prove peanut allergy, but skin testing, IgE testing. And sure enough, the protective effects remained, and we saw virtually no new cases, or perhaps one new case of peanut allergy in the original protected group. It means you can really train a baby's diet in the first year of life, which has lasting consequences all the way through to 13.
But even with the science clear, we're still facing roadblocks. Unclear guidelines, cultural fear, and a lack of consistent communication with new parents.
Still, a lot of guidelines are not sufficiently prescriptive. And they also are, some say, introduced around 6 months of age or around 4 to 6 months of age. Now, we know that peanut allergy occurs so rapidly in the first year of life. And this has been shown in other studies now, NIH-funded studies, that if you wait till 8 or 9 months of age, especially in babies with eczema, that may well be too late.
Dr. Lack points out that timing and frequency matters. Babies need regular, consistent exposure starting around 4 months, not 8 or 9.
Right. But changing minds isn't easy, especially when you're challenging long-standing medical guidance.
And then there's still the fear in the families. There's a real fear. Parents who have babies with eczema, who are the babies who should get the foods earliest, those are the most anxious parents and the most anxious pediatricians where the food is being avoided. And the fear of consumption actually leads to the allergy and becomes a self-fulfilling prophecy.
Dr. Lack is clear. It's not just about the science, it's about clear, consistent guidelines and education. And that's where clinicians and community leaders come in.
Translating that science into everyday action has been a mission taken up by countless professionals. Dr. Michael Pistiner, pediatric allergist and dad to a child with food allergies, knows this journey personally.
My journey as a pediatric allergist focused on food allergy started with my son, who's now 22. We delayed the introduction of the highly allergenic foods, even the ones that we were enjoying eating in the home. And it turns out that the foods that my son wound up being allergic to were the very foods that we were not feeding to him until he was a little older than 3. Our own personal experience with our son matched that of what we're starting to observe.
That real life experience shaped his passion, not just for treating allergies, but preventing them before they even start.
At times I forget what my hobby is and what my real job is. And so I've really gotten focused on going after some of the unmet needs specific to food allergy.
Dr. Pistiner made it a point to note, by the time most infants show up at his allergy clinic, it's already too late.
Most of the time they're coming because they already have a food allergy. FAMP-IT, the Food Allergy Management Prevention platform or toolkit for the infant and toddler, is meant to be put in the hands of primary care clinicians. So it can help support decision making, and it can help support family education and shared decision making while awaiting an allergist if needed. And the ultimate goal is to make it so perhaps the child who the primary care clinician is going to be thinking about in that case won't even need an allergist in the first place.
The FAMP-IT Toolkit, short for Food Allergy Management and Prevention for Infants and Toddlers, is designed to empower both families and frontline providers to act early, confidently, and safely.
By putting smart phrases that clinicians can put into their electronic medical record, by having the very same family education material messages that are then going to the clinicians themselves, but then also having very similar talking points and educational support that is going to WIC. So this way, there's no confusion, and all messaging to all of our audiences is the same.
And that consistent messaging is critical, especially through WIC, the federal program where nearly half of all U.S. infants receive nutrition services.
And so the amazing thing is that with the services that families are getting in their state and local WICs, they have touch points during pregnancy in the early months, and they have the potential to have continuity with WIC nutrition services where the focus is infant nutrition, where the time needed to be spent on having these conversations is there.
Primary care visits are packed. Vaccines, growth charts, sleep, safety, but WIC staff can spend the time to help parents feel confident introducing peanut foods.
WIC and the WIC package are based on the recommendations from the Dietary Guidelines for Americans, that it is a clear go, go, go. That these Dietary Guidelines for Americans really truly give permission to feed babies allergens including peanut around 6 months of life.
As Dr. Pistiner explained, every month matters in allergy prevention.
What some of the science is showing is that in the case of a kid with moderate to severe eczema, in the case of peanut, every month that you wait to introduce peanut beyond 6 months can significantly increase the odds of developing a peanut allergy, close to like 30%. And so this way, if babies are fed earlier, the chance of them already having an allergy is much, much less. So if there's something that delays introduction by months, by the time the kid tries, they may be allergic. But if they just introduced closer to that 6 months, especially around the 4 to 6 month mark, then chances are they wouldn't have had a reaction in the first place.
And while fear is real, the actual risk of severe reaction in infants is extremely low.
It does seem that younger children tend to have less severe reactions than older children. And in the case of the LEAP study, what they found was that when the young babies upon entry were having reactions, very few had significant reactions. Where then when they waited until they were 5, that was where more significant reactions were seen.
The future of prevention lies in teamwork and consistency, getting pediatricians, WIC staff, and families on the same page.
So I'm starting to see the same local primary care who's working with a local allergist, who's working with local WIC, all of them on the same page as far as the way they work together and make their recommendations to the families. I think is really pushing the fear away, getting everybody on the same page, and making a difference. So in my own community, I'm starting to see the primary care clinicians feeding earlier. I'm starting to also, while working with our state WIC, hearing their stories, that they're having these conversations and that the families are open to them and feeling comfortable with feeding. Because they're also not necessarily, in some cases, not getting conflicting advice from others, not getting conflicting advice from their primary care team. So as many of us can get on the same page, then it's going to give the support that the families need. So that's kind of where I see the future of education and the future of communicating these guidelines to folks.
Early introduction doesn't just help prevent allergy, it also creates opportunities for earlier treatments when allergies do develop.
I would get a kid initially and they would have multiple food allergies because they had delays in introduction. Now when I'm seeing them much younger, now I am able to have a kid who, instead of having 7 food allergies, they have 1 or 2. And then that is something that then we would be able to address using OIT in this younger population.
So what's the one message Dr. Pistiner wants to leave with all of us, parents, healthcare providers, and public health professionals?
Now acceptance that early introduction is safe and the new expectation. And I think that being able to communicate that this is no longer something new, this is no longer something rogue, this is standard of care, this is the way we take care of babies. And I think that being able to confidently share with others that early introduction does prevent peanut allergy and other allergies as well, and that if anyone feels uncomfortable, getting the conversation started super early with primary care clinician or with infant nutrition teams is going to be really important.
And while the science is clear, the system is still fragmented. Dr. Pistiner believes the true progress requires open access and shared tools.
Being able to work together, share common information, and to be able to all be on the same page is tricky, and I think going to be the way that moving forward we'll be able to normalize early introduction. One of the things that we can accomplish with the FAMP-IT toolkit is to be able to take the information that may not be available or easily digestible to some and create a free, open access, easy way to share it with whoever the stakeholder is. One of the things that I've been experiencing is that in some professional societies that there's excellent material available to members. In some of the published scientific papers, they are available to people who subscribe to those publications. and not all of the data is freely available and open access. And so this is where, as we start sharing this with each other, and despite not being members of certain professional societies, if our professional societies can work together, for example, American Academy of Pediatrics working with NAPNAP, working with family medicine professional societies, working with PA professional societies, working with National WIC Association, working with the state and local WICs. If everybody is able to communicate and work together, then everybody can get the same messaging and learn how the teams, either at the local level, at the state level, or also nationally, can all work together.
Until unified guidelines come along, the Dietary Guidelines for Americans offer a powerful, shared starting point.
In the meantime, the Dietary Guidelines for Americans is a really nice hold me over until more nuanced updating can happen. But for now, that's something that most of the stakeholders can get behind. That's something that the WIC teams have been behind, because that's the basis of the WIC package. That's something that folks in early infant nutrition can get behind, and that's also something that folks in primary care can get behind.
And then there's the voice of community impact. We have Cha-Cha Miller, a registered dietitian, maternal health advocate, and mom. She's worked in WIC clinics and online, helping parents cut through the noise.
Yes, Ashton, Cha-Cha is a force in the world of maternal and child health. From clinical work to social media, she brings clarity and care to every conversation about nutrition. Here's a little bit about her journey.
How I got my start in maternal and pediatric nutrition, it's kind of interesting because it came from a personal, real-life experience. I was taking prerequisites for my master's program when I was pregnant with my first child. And I just had such a hard time finding advice on nutrition that felt real and actionable and sustainable. And, when you go to the doctor, they're not really talking about nutrition that much. They're like, oh, are you taking a prenatal? And that's pretty much the end of it. So I had to do a lot of my own research. So fast forward, when I started my grad program, my first daughter was around 6 months old, and she was just starting solids, and I basically ran into the same problem of there being just such little child feeding advice that seemed realistic and sustainable, and that wouldn't have me in the grocery store spending $1 million every time. So I I guess I decided to be the one to change that. And that was what drew me specifically to, mom and baby nutrition, and eventually to the WIC program, which is where I got my start as a dietitian.
WIC, the Women, Infants, and Children Nutrition Program, serves around 40% of all babies born in the U.S. It's one of the biggest levers we have for shaping early health, and Cha-Cha knew that was the place to be.
I kind of figured if I was going to try to influence any sort of change in mom and baby nutrition, WIC would kind of be the best place to start. And in the work that I do, I am especially passionate about providing culturally responsive and individualized nutrition care for people who have historically or who have been historically marginalized. And that's a large percentage of the WIC population. And, when it comes to mainstream nutrition advice, it honestly doesn't work for most people.
That insight is huge, and it's something we can all take to heart in public health. It's not just about what the science says, it's how we deliver it.
So let's talk about the big moment we're all celebrating here today, the 10th anniversary of the LEAP study, the groundbreaking research that paved the way for early and frequent peanut introduction may prevent peanut allergies.
The LEAP study has been monumental, basically, in shaping the way that we talk about food allergies. What it has done is really provided practitioners and even patients with the data and the evidence that they need to confidently make that recommendation. Because when it comes to, practitioners, when it comes to doctors, it's like they need the data, they need the science to support it. And the LEAP study was just such a substantial body of research that it made sense. So it definitely helped to kind of shift the narrative for a lot of practitioners.
Despite the progress, fear still lingers. Cha-Cha sees this firsthand when working with families.
I think a lot of these public health initiatives that were intended to protect kids, with things like peanut bans, I think they actually did the public a huge disservice and created a lot of fear around introducing peanuts early. So like this mixed messaging, it often just sends my patients spiraling because they, hear one thing as the public narrative, like, oh my gosh, no peanuts. And then they hear me say something different and they just like don't know what to believe, which is fair. That makes sense. So what I try to do is just create a supportive environment for the family. I try to establish a trust, right? I provide them with the solid facts and the information. I often, almost always, reference the LEAP study. I provide practical ways for them to introduce peanuts. We talk about strategies in case there is a reaction, but, ultimately, I think I just lean on the data and I allow and encourage the family to just make an informed decision.
And she's not just offering encouragement. She's offering solutions that actually fit into families' lives.
I really try hard to ask questions about, their normal day-to-day diet. And then we come up with easy ways that they can kind of work peanuts in that, aren't any additional burden. Because, once you introduce peanuts early, you've also got to follow up with frequent exposure. So if it's not easy to incorporate peanut foods into their diet, then they just simply aren't going to do it. So you need to make it as easy and as effortless for people as possible, because that makes it more likely for them to, actually follow through.
WIC makes a huge difference when it comes to affordability and access.
I worked for WIC when I lived in Alabama, and our participants were allowed to purchase peanut butter with their WIC benefits, which is something huge because, it makes that early exposure a lot easier, right? But then, peanut butter is also a source of protein. You got fat, it's a wonderful food. Maybe I'm a little biased, but but that for sure made it like so much easier for me to continue kind of pushing the early and often message. Like, you already get the peanut butter with your WIC benefits. So, let's think about ways that we can kind of incorporate it in a very easy and effortless manner.
Even with access, fear of allergic reactions can still hold families back. Cha-Cha's approach, grounded in the facts.
While peanut allergies can be very serious for those who are impacted by them. And I never, ever want to minimize that because I know how serious they are and, how complex they can be for families and for kids. But the reality is that only a little over 2% of children in the US actually have a peanut allergy, which is not a lot. But the public perception is that like everyone has a peanut allergy. So once I ground families and parents and caregivers in that fact, they're usually like, oh, okay, like, I guess I don't have as much to worry about as I thought. So, once I reassure them with that, they're pretty shocked with that fact, but then they're a little bit more on board.
Cha-Cha's work extends beyond WIC clinics. On her Instagram platform, The Cardamom, she's built a safe space where moms, caregivers, and nutrition professionals can come together.
I also can relate to my followers because, I'm a mom in real life. So I understand where they're coming from with the hesitation and the fear, which is why I encourage and I also think empower everyone to really just make decisions for themselves and for their families that feel really good to them. Because navigating, how you feed your family has some very personal layers to it. So even if something is recommended or a best practice, that doesn't necessarily mean it is right for every family. So I tell people that. And, while I still encourage early introduction, I definitely don't force it on anyone. And really, I just provide the accurate information so that they can make an informed decision. And I think kind of giving people that power is like the main driver for, adoption of the practice.
That trust leads to action and sometimes beautiful breakthroughs.
I remember I had one mom I worked with during my time at WIC who, suspected that her child was neurodivergent, but she didn't have like a confirmed diagnosis or anything yet. So I provided her with some tips and some strategies because you could tell she was like really struggling. And, she called me a few weeks later and was literally crying because her son, touched a fruit for the first time like ever. And it's not always that you receive that direct feedback from families that like a tip you provided or, something you helped them with actually worked. So, when I get calls like that, I'm like, okay, I guess I'm kind of good at this. I guess I should keep going.
Cha-Cha has been a key voice in our Little Peanut early introduction campaign. She knows the power of seeing helpful, real-world resources reaching families who need them most.
Seeing my resources like out in the wild is really just a great feeling, knowing that I'm helping dispel myths and provide practical tips and tricks for real people that they can, integrate into their lives in a very real way. And, in addition to that, everyone from the National Peanut Board is like literally quite amazing. And, and I'm not just saying that, but, everyone is just, smart and passionate and dedicated, and everyone on who I've engaged with from the National Peanut Board, they're just like really good at what they do and they're fun to be around, and they're open to creative collaboration and ideas, and truthfully that does make a huge difference in choosing to move forward with these types of partnerships.
So what can groups like us, the National Peanut Board, do to support public health RDs and community nutrition experts like Cha-Cha?
More opportunities for provider education, more presence, and more resources that can be shared directly with patients. And I know for brands or for organizations like the National Peanut Board, that probably feels overwhelming because you're like, well, how many posters and, how many handouts do you really need? But sometimes you have to tell people 50-11 times, and then you have to show them 50-11 and 1 times. And, so the more that you vary the modalities of sharing the same information, even if it seems redundant, even if it seems repetitive, it is still like so supportive, so helpful in supporting the message.
Cha-Cha's advice for fellow dietitians and health professionals is gold.
I would say the most important thing, you first have to try to establish that trust, right? When it comes to patient care, I have found that trust is everything. A lot of people these days are very skeptical of the medical system and of healthcare providers. So if you can relate to a patient as a real person and build that relationship, then they are naturally going to be just more receptive to your messaging. And again, just, ground these conversations in the facts. We have the research to support that early introduction works, despite what your great grandma may say. But, I would say to provide the information for your patients, not parents. Well, parents too, but provide the information for your patients, and just to empower them to make the decisions that they feel most comfortable with. Like you can't force anyone to do anything. So the more autonomy that people have in making these deeply personal choices, the more likely they are to come out on the best side of things.
Now it's time to bring in our own Marquita Lewis, National Peanut Board's registered dietitian. She's been a major force behind getting the message of early introduction into the hands of healthcare providers and new parents.
That's right, Ashton. So, Marquita, how do you explain early peanut introduction to nervous parents?
I try to frame early intro as, a natural step in all the other food introductions that they're doing at this time. So, and something important to remember is that peanuts are a food just like any other, and it doesn't need to have this extra fear on it. And then something that a lot of people don't know, there are about 160 different foods that a person can be allergic to. Well, yes, we focus on the top 9 because they do cause about 90% of the food allergies. There are still so many others, and so we can't apply this fear to all foods. And then also, I like to remind parents that there are a lot of benefits. So if their child does happen to be allergic to peanuts whenever they early introduce, it's honestly better to figure that out sooner than later. So first of all, the reaction that an infant gets if they do an early introduction tends to be less severe than had they waited for a year or longer. So if they are worried about reaction, hey, if you get a smaller reaction earlier, that's a benefit. But then also, if, say, their child is allergic to something, it opens up the opportunity to figure out treatment methods earlier.
Let's tackle a few myths. What are the biggest misconceptions you still hear around peanut allergies?
One misconception that parents might do is like, oh, I'm going to test it on the skin before I feed it to the infant, and that isn't best practices. So there's some new research coming out about the dual exposure hypothesis, showing that like your body's immune system reacts to something different, whether it's coming in from the skin versus coming in orally. So there is a small chance that by, you just put some peanut butter on the skin, those proteins can go in and actually sensitize an infant to developing a peanut allergy versus, early intro through the mouth, where that does help the immune system adapt, recognize this as a safe food, and then hopefully not develop an allergies. And then another misconception that people have is that you should do like skin like full panel allergy testing before you introduce any of the major allergens. That's also not something that's recommended by the AAP, because sometimes those tests are inaccurate, so they only have about 60 to 70% accuracy, and so there could be some false positives.
And let's shift to equity. You've done a lot of work with WIC, the Women, Infants, and Children program. Why is it so critical that early intro messages reach this audience in particular?
About 50% of the babies born in the United States end up going through the WIC program. So every other child gets touched by WIC nutrition programs in some aspect. And so I think that is an excellent opportunity to reach people who are underserved, especially knowing that they might not have a primary care physician, or they might not have regular access to any other healthcare practitioner who can have these conversations about early introduction with them. And then we also know that in addition to the sometimes lack of access to healthcare, we also want to help them from having these families from having a lifelong burden. So a food allergy costs on average between $4,000 to $7,000.
WIC isn't just the touch point, it's the front line.
What strategies have worked best when building awareness in WIC in similar programs?
Honestly, be in the same room with everyone. So we at the National Peanut Board, we attend conferences for a variety of healthcare professionals, whether it's WIC, nurse practitioners, physician assistants, the pediatricians themselves. Often they're surprised to see us there. They're like, what's the National Peanut Board doing at this medical conference? But then they hear what we're talking about, and like that's been really great to start those conversations, whether it's people who've never heard of early intro before, or they're like, I know a little bit, but we really get them to that next step, kind of like me doing education. Like, awareness is the first step. We need you to do some action. So first of all, just being there is great. But then also we do try to partner in different ways, whether that's helping with education resources. We have the good fortune to have a lot of allies in the field. So whether it's like pediatricians and researchers like Dr. Mike Pistiner, or we have dietitians who do things with WIC, like registered dietitian Melina Malkani. So we have a lot of allies who we try to get that educational piece. And then, of course, the National Peanut Board, we try to make a bunch of free resources available out there, because I know when I was doing outpatient nutrition, I literally had a whole folder system of different handouts and things like that, because maybe some of the ones at the hospital weren't adequate. So just finding those good trusted resources that were free and easy to understand, like that made such a big difference.
That brings us to one of our most exciting efforts, our Little Peanut campaign. The center of the campaign is a lovable peanut plushie. What makes this project special to you, Marquita?
I love that it's making what seems like a scary topic, a little bit, it's disarming. It's making it a bit more approachable. And then, knowing how people learn, like the different modalities in which people learn, giving them the research article or a webinar, it can only do so much, but people really want something to connect with. And so I'm very glad that Little Peanut is one of those things that people can connect with.
And it's working. What have you seen in the field?
Basically, everyone falls in love with Little Peanut at first sight. And people are just walking by and they'll turn their heads. They're like, I need to know what's going on. So it's definitely an eye catcher and people love it. I've seen even registered dietitians who were new parents, and they're doing early intro with their kid and showing that process to their followers. They'd have their Little Peanut right next to it. Or I've seen people, for some of the practitioners who've given it to, the children are just locked in on Little Peanut. So I definitely think it's well received.
Public trust is everything. What advice do you have for dietitians and healthcare professionals who want to confidently talk about food allergy prevention?
Healthcare professionals, first of all, should always be lifelong learners. And so I do recommend go going out there, being curious, having an open mind, and finding what's out there. So whether that's finding the other healthcare professionals who talk about allergies, read some of the research that's out there, watch webinars, and I'd even say look at what the advocacy groups are doing. I know we care a lot about patient-centered care. Sometimes hearing those voices and seeing what they're talking about, like, patients often help us become more updated, because if the patient knows something and we don't, obviously we need to get our act together and research it so that we know how to be competent and have those conversations. And if people are looking for resources, the National Peanut Board does an excellent job on the preventpeanutallergies.org website to gather all of those free resources, just to make that continuing education a little bit easier.
What's the best way pediatricians and RDs can collaborate to make early introduction standard practice?
So I know a lot in outpatient clinics, there's typically a team. So perhaps something like having a team meeting specifically about early introduction, or maybe in the consulting, because usually you'll have your pediatrician visit, and then you can do additional consults out to dietitians. We understand that, pediatricians are super busy, and so really building that communication, figuring out, all right, who's going to talk to whom would be very beneficial. And then I like the idea of, while we do talk a lot in silos, like trying to figure out maybe some ways that maybe a dietitian goes to a different healthcare professionals conference and has the opportunity to speak, or vice versa, because there's so much that, even though we know so much in our individual areas, we have so much to learn from each other. So having that crosstalk, or even looking to see what we can do on a national level, whether it's through the CDC or the Department of Health and Human Services, doing something like that, really making it like a public health campaign, so that everyone has the skin in the game to make that happen.
Marquita, what's one takeaway you want our listeners to remember?
I think the most important thing to take away from this is that peanut allergies, or early introduction, is not as scary as you might think. You're not alone. There's definitely a network of people out there to help inform you, educate you, and meet your concerns. So I say, early intro is for everyone, and as we continue, we can make that more accessible for all.
Hey Lauren, one of the first people to truly believe in the power of science to make a difference was Dee Darden, a peanut farmer from Virginia and the former chair of the National Peanut Board.
Yes, Ashton, I love this story. Dee Dee is more than a farmer, she's a trailblazer. At a time when few wanted to even mention peanut allergies, she and the board decided to face the issue head on, investing time, funding, and heart into finding a solution.
Dee Dee, thanks so much for being here today. Let's start with the early days. What was the mood around peanut allergies when you first joined the National Peanut Board?
When we first got involved, we were excited. We had money. We wanted to do, research, and we wanted to do promotions and everything. But that peanut allergy was out there, and we knew we had to do something, but yet nobody wanted to talk about peanut allergies. The manufacturers, industry, no one wanted to talk about it. I think one time there was a 1-800 number on a jar of peanut butter, and that was the only way you could call up and maybe get an answer. But we knew from the very beginning that we needed to be involved.
And that commitment made all the difference. But there was a moment that really shaped your passion for this work, right?
We actually had an alternate member on our board who had a child that had a peanut allergy. And when we first started out, we were doing a lot of media and going around. And someone asked me the question, how does it feel to grow something that could potentially kill a child? And that hit hard because, as a mother and a grandmother, that hit really hard. And I thought, well, we've really got to do something about this. So I always said that if we were going to be part of the problem, we had to be part of the solution.
That solution would eventually come through science. Take us back to your first experience hearing about Dr. Gideon Lack through NPB's first CEO, Marie Finn, and the early conversations that led to LEAP.
I'll have to give it to Marie Finn when she developed the Scientific Advisory Committee. I happened to be the peanut board representative, but it was doctors, nurses, researchers, all came together. And the first time we got them all in a room, they were like so excited to meet everyone face to face and to be able to see each other and talk. And Dr. Lack was there, and when he presented his study and the science behind it, it just made perfect sense that we needed to go in his direction and fund his study, because it was like these researchers were like a bunch of little kids that, they wanted to get together and play, and so it was very exciting to be a small part of that. I didn't always understand everything that they were saying, but I knew that we were on the right track.
And Dee, there's even a funny story that you popped in to visit him in London while you were traveling and made sure he knew that peanut farmers wanted to support his work.
I appreciate the fact that he thought it was me, but I really do think that it was Marie. But I'll take credit for it, okay? You just want to tell Marie. But no, meeting Dr. Lack was a real honor, and what he was doing, but he was a nice gentleman and still is.
Funding LEAP wasn't an easy choice. There was a lot of risk.
And that leap of faith changed everything. So how did it feel when the results of the LEAP study were finally published?
It was kind of like birthing a baby. You would work with this stuff all along, and like you'd carried the baby, you'd been a part of it, you've seen it grow and grow and grow, and then all of a sudden when it was published, it was like, it's hard to describe how proud I was, but just to have been a small part of that study and to see it in action with the pediatricians and parents accepting it. So it really was a proud moment for me and for everybody else. Something would be on the TV or you'd see a magazine article. I say, look, this is something we did.
So Dee, from those early days to now, what makes you most proud of how far we've come?
When my daughter-in-law was pregnant with her first child, and she was afraid to eat a peanut while she was breastfeeding. And she was actually afraid of eating any kind of peanut product or introducing any peanut product to her son. And I'm like, no, these studies are going on, blah, 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 blah. So many years later, when I went to the pediatrician with my daughter, and so Natalie now is 8 years old, and we went to the pediatrician, and I went with her, and she said, I want you to know that there's a study out about introducing peanuts to young children. And I'm sitting there thinking, really? I know all about that. So that was like a great turn of events from 20 plus years ago to today, or 8 years ago, that how we had progressed and come along.
And looking ahead, what's your vision for the future of peanut allergy prevention?
We were able to provide some answers to a lot of questions. And I know I read something recently that only 60% of the parents and maybe pediatricians are on board with feeding kids early. So I think we've got that 40% out there that we need to educate. So I would hope that the board would continue to fund research and really to focus on educating pediatricians, nutritionists, researchers, parents, that, it's okay to feed these allergens and peanuts early, and we've got the science and the research to back it up. And so, through education, research, and through all the efforts that the National Peanut Board is doing and hopefully will continue to do, we'll just maybe one day wipe out allergies. Wouldn't that be great, that parents wouldn't have to worry about what they fed their children?
You've truly helped shape a legacy. From that first uncomfortable question to watching your own granddaughter's doctor cite the research you helped make possible. It's really full circle.
You didn't just represent farmers, you helped them lead the charge on one of the biggest public health breakthroughs of the last decade, and that's powerful. As we celebrate 10 years of progress, there's still a lot of work to be done. Dr. Lack shared his hope that we'll get bolder in our guidelines and braver in our outreach.
I think the guidelines do need to be far more prescriptive. People need to talk about frequent, regular consumption of the food.
And Cha-Cha reminded us that at the heart of all of this is trust.
Trust is everything. A lot of people these days are very skeptical of the medical system and of healthcare providers. So if you can relate to a patient as a real person and build that relationship, then they are naturally going to be just more receptive to your messaging.
So where do we go from here? Keep showing up, keep educating, keep making early peanut introduction not only a medical guideline, but a cultural norm.
If you're a parent, a healthcare provider, a public health leader, or just someone who cares, you have a role to play. Start the conversation, share the facts, visit preventpeanutallergies.org for tools, FAQs, and ways to get involved.
And now we're going to move over to one of my favorite portions of the Peanut Podcast.
Yeah.
The trivia time. Yay! So today's trivia question, Lauren, I have for you. It's directly from today's episode of Peanut Allergy Prevention.
Okay.
Let's see who is paying attention out there, and let's see if you were you listening, Lauren.
All right.
So here we go. Here's the question. Which country's infant feeding habits help inspire the LEAP study after researchers noticed their peanut allergy rates were significantly lower than it was in the US and UK? Was it A, Japan? Was it B, Israel? C, Australia? Or D, Sweden?
Good questions. You do have to be paying attention, and you would have gotten this one. I've been around for a while, so I'm fairly confident that it's B, Israel.
B, Israel? You locking that in, Lauren?
I'm locking it in.
All right. Ding, 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 ding. That is exactly right. You got it. It is Israel. And in Israel, babies commonly eat peanut snacks like Bamba starting around 4 to 6 months. And the researchers noticed that peanut allergy was almost unheard of there. That comparison kicked off the entire LEAP movement.
So it's crazy how one cultural norm, like feeding babies peanut puffs, sparked global research that really changed lives. It's proof that sometimes the answers are already in practice somewhere else.
Exactly, Lauren. Global inspiration, local action.
Here we go.
To all of our guests, Dr. Gideon Lack, Dr. Mike Pistiner, Dee Dee Darden, Cha-Cha Miller, and Marquita Lewis, and the many who are carrying the work forward, we thank you here at the National Peanut Board. And thanks to you, our listeners, for tuning in to this special edition of the Peanut Podcast.
And don't forget to subscribe, share, and leave us a review, and keep helping us spread the word that early and often works.
Until next time, take care. And hey, Lauren, pass the peanut butter.
Here you go.